somebody known to you is suffering from pilonidal sinus and you're wondering if he needs surgery and what kind of surgery, then let's discuss it today. Hello, I'm Dr. Sushil Naite, plastic and reconstructive surgeon working at Leelavati Hospital, Bandra and Plastic House Clinic, Borivali. So the key surgical indications in pilonidal sinus is obviously abscess, which is pilonidal abscess, which requires emergency surgery in the form of incision and drainage to let the pus out and relieve the patient from pain and suffering. But the most common complication in pilonidal sinus is when it recurs or it becomes chronic. So in that case, there are multiple surgeries proposed. The common surgical procedures are excision of the sinus tract and leaving the wound for healing by itself. The pilonidal sinus is excised surgically and the wound is let to heal by itself. Multiple dressings are done in the post-operative period and on regular interval to let the wound heal from the base towards skin. The most common problem with this modality is requirement of multiple dressings, which are obviously done in the OPD setup and can be painful for the patient. So it is not recommended or not commonly done procedure in the current scenario. The sinus is excised and can be closed primarily, or a flap is done in which local tissue is rearranged to close the cavity after excision of the sinus cavity. After sinus cavity excision, it leaves a big gap there, which is filled by local tissue rearrangement in the flap surgery. So you would be wondering what to prefer, whether to do a primary closure or do a flap surgery, because flap surgery is little expensive. Although the duration of surgery and pain in the initial post-operative period is more with flap surgery as compared to primary closure, it should be the preferred choice of closure after sinus excision, because the post-operative complications in early post-operative period like wound infection or seroma formation or wound adhesions are more common with primary closure compared to flap surgery. And the most important benefit of flap surgery, it flattens the area between the two buttocks and it reduces tension in the over the suture line and it significantly reduces the chances of recurrence. So flap surgery should be preferred over primary closure after excision of sinus cavity. I also propose laser hair ablation after surgery because pilonidal sinus is more common in hirsute people. So hair is the root cause of pilonidal sinus and especially the recurrence of pilonidal sinus. So hair ablation should be seriously considered. Thank you.